Good morning. Today we are going to discuss the difference between malaria and typhoid. But before we start, I have to introduce myself. I'm Dr. Njemanze Augustine from Medical City Hospital, Owerri. Now, malaria and typhoid are ailments that are common in society, but easily misdiagnosed one for the other. Malaria is essentially an ailment or a sickness that is characterized by increase in the body temperature known as fever. Occasionally, the individual may complain of headaches, body aches and joint pains, and also there may be vomiting. The individual may also complain of chills, that is feeling cold, and may be shaking, which we refer to as rigor. Typhoid, on the other hand, is an ailment that can easily be misdiagnosed, as I initially noted, as malaria, and most times patients mistake one for the other. Now, typhoid is essentially a sickness that is caused by food, is essentially a food and waterborne disease, and incidentally it has similar features as malaria, such as elevated body temperature known as fever. There may be body aches. There may also be stomach discomfort. Vomiting may also be there. Now, once in a while, the patient may complain of, or the individual may complain of passing of watery stool, which may also interface with passage of hard stool, known as constipation. Okay, now we want to look into why there may be misdiagnosis. It's easy to misdiagnose one of these ailments, one for the other. Now, we find out that there are many ailments that can masquerade with these symptoms, such as fever, elevated body temperature, body aches, weight loss, decreased appetite, and also stomach discomfort. So it is essential that once an individual comes down with these symptoms, the individual must be advised to seek medical care from a qualified medical practitioner, not going to the lab, not going to the pharmacist, but come straight to the hospital so as to prevent the pitfalls and the consequent dangers of the diagnosis. So, when is an individual advised to come to the hospital to test for malaria and typhoid? Now, as I have said before, this is when the individual comes down with these cardinal symptoms of fever, body aches, chills and rigor, and loss of appetite, stomach discomfort, and loss of appetite. Now, you find out that it is very essential to make this diagnosis on time, because they have complications which, if misdiagnosed or diagnosed late, could result in fatalities. For malaria, it could lead to cerebral malaria. Now, this patient that comes down with cerebral malaria will definitely be unconscious, which is a serious complication of malaria. Now, for typhoid, it could lead to what we call typhoid ileal perforation, and this is a dangerous gastrointestinal complication of typhoid, which could lead to emergency surgery. Now, we want to prevent this, so the individual must be made to come to the hospital and consult a qualified medical practitioner who will take a good history. Every medical treatment starts with a good history. Examine this individual or patient, physical examination. Send for the appropriate investigations as the history and the examination is guiding the doctor towards his diagnosis, which is differential 1, 2, 3. Now, when this is done, when the results are available, the doctor now treats accordingly. There is another danger. This fever, joint aches, chills, occasional chills and rigor, stomach discomfort, these things can also mimic immune suppression, such as HIV/AIDS, cancer. So some injection of some dangerous drugs such as steroids. So you can see that it's not definitely every fever and chills and rigor and stomach discomfort that is malaria and typhoid, which is what we see commonly in our society. Once a patient or an individual comes down with these symptoms, they go to the pharmacist, go to the lab scientist. Oh, of course, it's malaria and typhoid. They treat accordingly, and the patient is having something more sinister. So, in closing, I would strongly advise the public to be health conscious, to make the right decisions. You don't look at the cost, because eventually, when you make the right decisions, it is cost effective. What are these right decisions? When you have these symptoms, come to the hospital, consult a qualified medical practitioner who will take an adequate history, examine the patient or the individual, and send for relevant investigations to tie his findings and his diagnosis together before starting treatment timeously, very important. So, in closing and in a nutshell, the public is advised to come to the hospital on time and consult a qualified medical practitioner. Now, we have a legion of such qualified medical practitioners in Medical City Hospital. And on this note, I advise the public to come to Medical City Hospital and consult the qualified medical practitioners that are evidently abundant in these facilities. Thank you.